So what is ESWT? What does it stand for? It's called extracorporeal shockwave therapy. It's completely non-invasive. Extracorporeal means out of the body. It works through sound waves. And how do these sound waves work? Well, they work through an interaction when the sound wave hits the tissue. We're talking about not plantar fasciitis, which is inflammatory. We're talking about plantar fasciosis, Achilles tendinosis, anything that's degenerative. And what does degenerative mean? Degenerative means that it's not caused entirely by inflammation. Inflammation may be, chronic inflammation may be the original cause of it, but the actual tissue, I used to call it before the words, it shows you how long I've been doing this, before Harvey Lamont at the Temple School of Podiatry coined the term fasciosis, I called it a soft tissue malunion. What does that mean? Well, let's look at the fascia. The fascia is degenerative, you have poor circulation, it doesn't heal, just like a bone doesn't heal. In fact, ESWT can be used for non-unions. It's not that popular in the United States, but in Europe, it's very popular and extremely effective. So ESWT, at a different dosage and a different spot size, can heal non-unions. At a different power and dosage, it can heal soft tissue. Very important. It's not for plantar fasciitis, it's for plantar fasciosis. Osis is degeneration. In the lower extremity, the main two indications are Achilles tendinosis. We've used it for plantar fasciosis, sesamoidosis or sesamoiditis, degenerative neuromas. What's the piece of equipment we use? We use the Dornier EPOS Ultra. Ultra stands for ultrasound. It is the only machine that is class 3. And what does a class 3 mean? A class 3 means that it didn't get a clearance. It went for a PMA, pre-marketing approval, which means it had to undergo double-blind, randomized, placebo-controlled studies. And that's important. In subsequent and future these video webinars, I'm going to talk about any topic that you want to talk about, but I want to go over the various evidence-based medicine. That seems to be a very important topic, and I want to describe how the Dornier EPOS Ultra stands up to the criteria of evidence-based medicine. There's one, which is a double-blind, randomized, placebo-controlled study, all the way down to where you have a case study or a review. Again, the Dornier EPOS Ultra has stood the test of time. When I talk about something, I'm not talking about an opinion. I'm talking about based on either peer-reviewed literature or FDA studies. I'll bet you didn't know where the Dornier EPOS Ultra underwent its FDA studies. It underwent its FDA studies at Harvard Medical School, Emory, Henry Ford, Kennedy Fowler. Excellent Shockwave Therapy has done thousands of these treatments. We have thousands of reviews. In the future, I plan on going over specific case studies, how to evaluate the patient, how to get better results, how to pick the perfect ESWT patient. I'm here to help you, and more important, the purpose of this goal is to educate you so you can educate your patients, because after all, that's why we're here. Whenever you have a patient that is educated, you're halfway there in helping the patient get the proper treatment. I hope to push through the confusion and claims of conditions such as stem cell, PRP, Tenex, Topaz. There's a whole variety of these treatments. Again, if there's any topic that you wish to talk about regarding almost anything, but I would prefer ESWT. What's the difference between low energy? What's the difference between high energy? How important is the dosage? How important is ultrasound guidance? How important is using a machine that has multiple evidence one double-blind randomized studies, not only within the FDA studies, but outside of the FDA studies? I won't bore you with a lot of literature and technical things, but I do want you to feel free to ask me any questions. Email me. You'll get my email. And most important is we have a webinar that we have done for over almost 20 years that we're very happy to include you, which will go through the ABCs of ESWT with the Dornier EPOS Ultra, how you can bring this technology to your office without any investment, how we basically help you manage the financial aspects of it. We have a turnkey operation with our company called Excellence Shockwave Therapy. We're not new, we're not old, we are the pioneers, and we want you to be able to offer ESWT with the Dornier EPOS Ultra so your patients get the best quality care.